Is now starting. All attendees are in listen-only mode.
Welcome to eGestalt's webinar titled Build Your Presence in the Healthcare Vertical by Offering HIPAA HITECH Compliance Services. Today's presenter is Nate Miller, Regional Sales Manager, eGestalt Inc. Nate is an experienced technology sales professional with 8+ years in the industry. He has extensive experience in both channel and direct sales and has led teams of 10+ people managing more than $20 million in technology service and support contracts. Prior to eGestalt, he worked at ServiceSource on the Sun Microsystems account, where he grew the annual regional revenues from $5 million to $20 million. If you have any questions, please send them via the questions function in GoToWebinar, and we will address them at the end of the presentation. If you'd like a copy of the presentation, please send an email directly to Nate. His contact information will be given at the end. Thank you, Nate, for presenting. I'll turn the webinar over to you now.
Thank you, Mike. Welcome, everyone. Today we'll be going over some ways you as a managed service provider, IT services provider, those kind of businesses can expand your presence in the healthcare vertical. As I'm sure you know, it's a big growth industry right now. There's a lot of money in this space, and a lot of people are looking for ways to break into the area, and eGestalt offers that through our secure GRC tool. So we'll just go over a few basic things here first, just so the terminology is familiar. So HIPAA was passed in 1996, and it was designed to ensure the portability and security of patients' health information. So it primarily, at that time it was paper records, and it wanted to ensure that, patients could move doctors, take their records with them, and ensure sharing there. HITECH was passed in 2009 as part of the stimulus package, and this was really a game changer. It greatly expanded the different fines, those sort of things around breaches of health information, and also put in sort of a carrot there for the adoption of electronic medical record technologies. And its provisions came into effect in February of 2010, and they're continuing to kind of build from there. So here are a few acronyms we'll be touching on today. The HHS is the Department of Health and Human Services. That is the umbrella agency responsible for enforcing HIPAA and HITECH. The OCR is the Office of Civil Rights. It's a department within the HHS. That is the actual agency tasked with enforcing the actual laws. So they're the prosecuting entity. Previously to HITECH, HIPAA enforcement was in a kind of obscure department of the HHS, very little funding, not very aggressive. The OCR is very well funded and known as a very aggressive enforcement agency. PHI and EPHI are either protected or electronic protected health information. So that's the kind of end product from doctors, and that's what's really covered by the scope of those laws. Covered entities are any medical provider out there, so your doctor, dentist, chiropractor, those kinds of businesses, and they're the ones producing the EPHI. A business associate is anyone who does business with a covered entity and has access to that EPHI, and they are actually governed by the same rules and regulations as the covered entity as far as protection of that information. And then an EP is an eligible provider, and that's someone who's eligible for reimbursement for their installation of their EMR system. So what's really driving the market right now, and why it's such an exciting opportunity in the HIPAA HITECH sphere and healthcare industry more broadly, is both the new rules and regulations being passed by Congress and on the state levels, and then the adoption of those EMR technologies. Congress here has put increased penalties in place, but also they put $23 billion in possible reimbursements for those installations. We'll go over this a little more in depth later in the presentation. but this is why there's such a rush right now, and why it's such an exciting time to be getting into the healthcare IT space. So every day we're seeing more and more reported breaches of the protected health information. They're publicized every day. You might see them in your newspaper if you subscribe to different health IT newsletters, those sort of things, and they're being reported in greater numbers, mainly because there's new reporting requirements in the HITECH Act. So these are just some different breaches that have been reported, splashed all over the news, and it can be, for a medical provider, it can be really damaging to their reputation in the community to have a breach. So there's some big fines coming down the pipe. We've seen fines in the $1 million+ range. If people are going for the reimbursements for installation of their EMR systems, and they have to meet certain criteria. If they do not correctly meet those, they can be fined up to $50K. And we've seen fines up to $4.5 million for loss of patient health information. So HITECH, as mentioned before, was really a game changer. It changed the fine from a single breach of a patient health record. So, if your record was lost previously, you could be fined up to $100. Now, per breach, the maximum fine has been raised to $50,000. Willful neglect, where you know that you are not in compliance with HIPAA HITECH, has been raised from $25K up to $1.5 million. Attorney generals can now prosecute HIPAA HITECH violations, and this is a really big one because it's expanded the scope of the agencies that can actually go after violators. So a lot of the smaller breaches are now being prosecuted. And both the OCR and attorney generals can now keep a portion of the fines they levy for violators. So this has created a self-funding mechanism for the law, for its enforcement, and also with state budgets generally being deeply in the red, it's creating a big incentive for state attorney generals to aggressively enforce these laws and go after violators. And then also the OCR has trained all of the state attorney generals on HIPAA HITECH and the rules and how to prosecute breaches. There's even criminal liabilities in this space. So for certain kind of malicious use of patient health or protected health information, people can actually go to jail for this. There's also breach rules that require any loss of PHI over a certain level is required to be reported, and it varies whether it's just to the HHS or the state attorney general. There's also some requirements for larger breaches where you have to notify local media, those sort of things. So the breach rules can be pretty onerous. And then finally, one of the biggest changes was that the scope of HIPAA HITECH was extended to business associates. So this has really expanded the market here and increased the opportunity for people breaking into the healthcare IT space. So the reimbursement program, the Medicare and Medicaid Electronic Health Record Incentive Program, provides up to $44K over a span of 5 years for adoption of an EMR, EHR system. The difference there in the terminology, electronic medical record is the kind of basic system where a doctor would just record the information. An EHR system means that it's interoperable with other systems out there, so there's a lot more possibilities for sharing data. So a lot of times those two terms can be used interchangeably, but there is a distinction. So the 44K over 5 years, hospitals are eligible for up to $2 million for the installation of the EHR system. So far, a little over $3 billion has been paid out to about 2,000 hospitals, 41,000 physicians, and there's about an additional $20 billion that's still out there available. So to get the maximum incentive, covered entities have to begin what's called attestation to meaningful use by the end of 2012. So the money is being doled out in 3 stages. Stage 1 is $18K, and then there's going to be 2 additional stages. And so basically providers have to install their EMR by the end of this year, and then prove meaningful use, show that they're using it to improve patient care, reduce costs, those sort of things. The deadline for attestation for last year recently was extended to the end of this month, but obviously we're coming rapidly to the end of that. So basically people are just looking at this year at this point. So in stage 1 of meaningful use, there's 15 core objectives, and all of these have to be met for a covered entity, for a physician to receive their 18K. The first 14 are really all on the medical side. So as you can see, there are different things. Are you conducting drug interaction or allergy checks, checking, vital signs, checking blood pressure, those sort of things, smoking status. But number 15 of the 15 core objectives is that covered entities protect the electronic health information that their EHR systems are generating. And this has to be done by conducting a security risk analysis. And what this is kind of led to a lot of confusion, because a lot of EMR vendors are coming in and basically their systems will get certified by the HHS as being HIPAA HITECH compliant. However, just because the actual EHR is HIPAA HITECH compliant does not mean that just through installation of the EHR, the whole entire practice is going to be HIPAA HITECH compliant. And so there's some misleading information out there, but providers need to know that to get their reimbursement, they do have to meet the 15 core criteria, and the way to meet number 15 is that they conduct a security risk analysis, and eGestalt's tool, Secure GRC, meets the criteria for that security risk analysis. So this here basically breaks down the time it takes to meet meaningful use, and these statistics were published by the HHS, kind of a breakdown of how long it will take. The actual core set should take about 9 to 10 hours. However, of those, 6 of them are projected to be spent on the security risk analysis. So it takes over 2/3 of the time. And for a small to medium-sized doctor office, doing a security risk analysis, they can really struggle through this because if they have internal IT resources, a lot of times they're not full-time, they don't have that much experience doing a risk analysis, are really going to struggle through it. And I'll actually run into a lot of providers who have kind of fudged this area and attested to meaningful use without actually doing a comprehensive security risk analysis. And as was mentioned before, that can actually subject them to fines of up to $50K for false attestation, and they can be audited up to 6 years down the road from the date they attest. So the stage 2 requirements are currently in their comment phase, and that just means that they've been published by the HHS and they're accepting comments from providers, different companies on those. So they're subject to revision, but generally in this phase they're pretty firmed up, and there's a few high-level takeaways that should be of interest to you. One of them is that the eligible providers, the doctors, use a secure electronic messaging system, basically generally encrypted email, to communicate with their patients. Hospitals need to start offering online access to patient health records. And then one of the biggest ones is there's new privacy and security requirements, and one of those is that data at rest, the end product, the PHI from the EHR systems, be encrypted. One of the biggest sources of breaches in this space is the loss of endpoint devices. So whether it be a portable hard drive, a laptop, a tablet computer, a PDA, those sort of things, they actually account for over 50% of the breaches out there today. So this, with encryption basically being mandated for all endpoint devices, it's a great opportunity for IT services providers to add that to their portfolio of services, because medical providers, to get the next stage of funding for their EHR systems, are going to have to be rolling out encryption services along with the secure electronic messaging. So eGestalt, so why partner with us? How can we help you break into this space, build your business in this space? Well, we're the first true cloud-based security and governance, risk and compliance platform. We built our tool from the ground up with the channel in mind. We're 100% channel focused. We don't sell direct at all, so we won't be competing with you on deals. If we get leads, we refer them to our partners. And as we are 100% channel focused, we built the solution as a multi-tenant one. So you can view from a single dashboard your entire install base, where all of your customers stand in their kind of compliance services status. We can scale from really a single user, single doctor, chiropractor in an office, up to an enterprise. So really, any type of clients you support, we can help you to deliver HIPAA HITECH compliance services to them and help them to meet meaningful use requirements. Our solution, Secure GRC, has policy and procedure and best practices built into the tool. So while your customers are actually doing an assessment, they can, in the tool, download these policy procedures. All their information would be auto-filled, and they can edit them in line in the tool. Our solution is really a fraction of the price. Anything comparable I've seen really starts 5 to 10x of the price we're offering this for. And we have a turnkey solution. So if you want to offer compliance services to your customers, however, don't want to kind of gain the knowledge on compliance and actually be taking the calls from your customers, you can just resell the solution. We will provide the back-end support your customer through their assessment, help them get to compliance, create a roadmap in conjunction with you to remediate any any IT vulnerabilities down the road, and it really takes it off your plate, allows you to sell it from day one without having to gain too much knowledge on the compliance front. So the solution can really scale from the small business up to the enterprise. Along with HIPAA HITECH, we support PCI. So if you have any customers who are subject to PCI, which is payment card industry, anyone who takes credit cards is subject to PCI compliance. And the pricing kind of scales along with that. So our Secure GRC SB starts at an end user price of $750 per license, and that and then you obviously would get your channel partner discount off that, and then scales up to kind of $7,500 and above for the full enterprise tool. So the difference really in the tools are the Enterprise is fully customizable, supports PCI HIPAA, and can also plug in a variety of different compliance frameworks. Anything in the Unified Compliance Framework, which is about 400 global regulations, can be supported. It can support either using the tool as sort of a pre-audit before an auditor comes in, or we also partner with auditors who use the tool to actually deliver their audits. And then as far as compliance, it's really compliance is not a one-time event. It shouldn't be just a one-time audit during the year. You should be, continuously monitoring things. So we built that into the Enterprise version, and it can really be used to track compliance throughout the year, address things as they come up, and always have an up-to-date view on the compliance status for your customers. The SB version is designed more as a self-assessment for the end user. So it has enough help and best practices built in where your customers can largely go through the assessment themselves, answering the questions with a little help from you, or if you're interested in using the turnkey solution, subbing it back through us. There's a continuous compliance version available, and SB version supports HIPAA HITECH and PCI levels 3 and 4. Those are the smaller PCI customers. And then another really neat tool we have is our HiScan tool, and that's a way for covered entities, those doctors, hospitals, to manage the compliance status of their business associate, anyone they're doing business with, having access to their PHI. And so, as an IT services provider, you almost always are going to be a business associate and, subject to the HIPAA HITECH rules and regulations. But this tool allows covered entities to send out a shortened assessment to all of their business associates and get those answers back, understand them, see who are the highest risk business associates, and then you will work in conjunction with, generally hospitals are most of our current customers, work in conjunction with that hospital to approach those business associates who are not compliant, let them know they need to take some steps around compliance, and the hospital generally will kind of, if they don't take steps there, they'll generally terminate the business relationship there. So it can be a great way to bring on some additional customers, sell additional assessments there. So through our market research, we've identified about 2 million small to medium-sized medical providers in the U.S., and then there's literally multi-millions of business associates here. So one of the best things about selling these HIPAA HITECH support services, the compliance services, is that as you bring on covered entity customers, those medical providers, they're really required to make sure that all of their business associates, that they have a comprehensive BA agreement and some evidence of their compliance. So it's a great way to talk with your medical provider customers, say, hey, I see you're going through the assessment, doesn't look like you have evidence from any of your business associates on their compliance, don't have an up-to-date business associate agreement. How about on your behalf, I'll put in calls to all of these BAs to get some evidence of their compliance, and if not, we start the conversation around what they need to do to become compliant. Generally, doctors are really happy, offer this service for free, so you can start calling their business associates and beginning the conversation about compliance with them there. As you bring in on some business associate clients, they generally have multiple doctor clients, so you could, as they get through the assessment, as they become compliant, can send out those the proof of compliance to kind of differentiate their offerings for their providers. Looks like we got a question here. Oh, sorry. So this just breaks down these statistics were up through 2011. They're from the HHS, Department of Health and Human Services, and they break down where the bulk of PHI breaches come from. There's been over 11 million total breaches of protected health information, and over 52% of that total number has come from the business associate losing the data. So this really emphasizes how important it is to make sure as a covered entity, as a medical provider, that your business associates are HIPAA HITECH compliant. So the HiScan assessment, it's a quick, simple assessment. Basically we would upload the list of all of the business associates from a covered entity into the tool. It automatically sends out a shortened assessment to them. Then you as the service provider, as the managed compliance provider, which is what we call our partners, would target those business associates for secure GRC licenses if they are not compliant. So it's a great selling tool and a huge value for your actual covered entities. We'll now get into, this is a quick overview of the actual, some of the questions from the HiScan assessment. Everything's broken down into yes, no. There's there's citation guidance, which lets them know where these questions are coming from, those sort of things. We'll now get into the tool itself, so go through a few shots of this. For you as a provider, as a managed compliance provider, it's really fast and easy to provision new customers. It takes about 5 minutes to add a new customer on. You just have to enter the type of assessment they'll be doing, whether it's a small business or enterprise. Enter their email and their customer name here. An email is auto-generated by the system sent to them saying, your assessment is ready. The solution is brandable, as you can see. You can put your logo into the tool, so the customer is seeing your logo while they're going through the assessment. And then you can also add the the customer logo if you'd like there. The Secure GRC SB is, at its core, it's a way to deliver web-based self-assessment. So the customer is going through these assessments on their own, for the most part, answering a series of yes-no questions. So here this question is breaking down some of the breach rules, and so basically it's asking, do you notify people when a breach to their PHI has been detected? If they're answering yes to these questions, they would need to upload evidence that, yes, we do have this policy and procedure in place. So this does a couple things. A, it allows them to, centrally manage their policy and procedures, and then B, it also creates an audit trail. So, if there was a breach or they did get audited, they would be able to go through with the auditor, break down, where all their policies and procedures, when they were put in place, what they've done around, rolling these out. However, if while they're doing the assessment, they do not have a policy and procedure document, just at a click in the tool, they can bring up a sample policy and procedure document that we've validated, we've worked through, and kind of based on best practices created this set of documents. So they can bring it up right in the tool. The company name will be auto-filled based on how you've set them up when you first provision them. So that would all be auto-filled. They can do editing in the tool and then upload that document as evidence. So while they're doing the assessment, they're getting more and more compliant. For all the questions, we have a ton of built-in content and research in the tool. The citation guidance here really shows where this question is coming from, what aspect of the HIPAA high-tech law or IT security best practices the question is coming from. The best practices just break down, the gold standard for every area here. For your customers, as they're going through the assessment, they have a real-time status of their compliance. So it will show them this temperature bar kind of up here breaks down, as they're going through the assessment, keeps them, gives them some tangible feedback that yes, we are becoming more compliant. So that'll move closer and closer to the green. The progress chart shows how many questions they have answered, how many they still need to answer, and then the unique questions. Some questions apply to sort of multiple areas of the regulations, so those are all auto-filled, and so they don't need to answer those sort of duplicate questions, even though they really do need to break them down in multiple levels to truly be compliant in the regulation. And then the risk chart just breaks down their answers by high, medium, and low, and can help with prioritization for the remediation efforts. The master console from your end as the IT services provider will show where all of your customers stand in their assessments. It'll help you let them know if some, they've kind of stalled on their assessment, may need a quick call to see, if they have some problem there, kind of see where their compliance is, and this is all done with kind of customizable widgets, so you can customize your view as the service provider to meet your needs. The end result of an engagement really is the HIPAA high-tech report on compliance, what we call an HROC. So this is a document that is generated in the tool and breaks down for your customers. It breaks down their risk report, shows their high, medium, low risk items, the things they haven't been able to remediate on sort of a first pass assessment. It provides a roadmap to remediate those outstanding risk items. So this is a great selling tool for you to break down, for them to put in customized recommendations into the report saying, hey, maybe you lack, you need to upgrade your firewall, you need a unified threat management firewall, or you don't have endpoint encryption, those sort of things, and put a recommendation for a solution you sell right in the report. And this is what kind of you hand over to your customer after they've gone through the assessment, and this is a great value for them on a few levels. So first of all, if as a covered entity, they can use this document, submit it when attesting to meaningful use to get their reimbursement for their EMR system. If there was a breach, they would be able to hand this over. It provides a complete breakdown to any enforcement agency coming in, or auditors. There's actually a random audit program right now being done by the HHS of providers, and they're looking to expand it based on the kind of first round of random audits. So providers can be subject to random audits there. And then from the business associate side, they can send this to all their covered entity clients to break down, to show them, all the steps they've been taking around compliance. So it's a really valuable document for them. And then if they're using a continuous compliance version as throughout the year as they remediate more items, you can always update this document really easily. So it's always going to be up to date. So why should you, why should you as a channel provider bring on compliance services? So first of all, it's recurring, it's a high margin recurring revenue. By law, providers need to be doing at least an annual assessment. For hospitals, there's audit requirements, but for the small providers, they need to be doing this on an annual basis. And obviously, right now with the meaningful use attestation going on, it's a must-have for anyone going. This or something like it is a must-have for anyone going for that stage one of the federal dollars. For you, it drives add-on products and services, so you can sell a lot of additional products that you offer to remediate a lot of the gaps that are going to be identified through the assessment. It's very high value to the end user. They generally come out of the process astonished by how out of compliance they were, and also kind of how easy a lot of those out of compliance items were to address. And it allows you to differentiate your offerings. A lot of managed service providers out there, IT service providers, security firms are not offering kind of a comprehensive compliance solution right now. So it kind of allows you to differentiate your offerings, really sets you up as that trusted advisor, so you're not competing over a few bucks in difference in price with other providers out there, and really gets you integrated in their business, creates that stickiness, so you're not going to be having to really heavily compete on an annual basis for this business. And then we also have those variety of partnership options. If you want to deliver the service, provide the support, you can do that. The turnkey offering, as I mentioned before, you can kind of start selling from day one. If we get off this webinar right now, you have a customer in mind, call them up, sell the service. We can get them going, within the day, basically. So you don't really have to learn, the compliance regulations there. So that about wraps it up for my end of the presentation. We'll begin a little Q&A here. Looks like we had one quick question about the slides, and yes, feel free to email me, and I'll provide you the slide deck if you'd like to review them. And let me see here. We've got a couple others in the question pane.
Great. Thanks, Nate, for presenting. I'll go ahead and handle the Q&A.
Okay.
We have a couple questions here. I'll read them off, and you can answer them. The first question is, what is the legal liability for the report to the partner?
Mm-hmm. Yeah, that's a great question. So the actual, because especially on the SB side, it is a self-assessment, that really insulates you as a person delivering the report from a lot of the liability. So as it's a self-assessment, it's based on their answers. So if the end user's answering incorrectly, or either purposefully or on accident, there's language in the reports that says this is based off of your answers. We cannot, it's not a guarantee of compliance, those sort of things. And also just the way HIPAA HITECH is written, it's a reasonable best effort for for the covered entities, for the providers and their business associates. So if they're taking some concrete steps to be compliant, that really insulates them from possible fines and those sort of things. So even if they did get hacked, I mean, it can happen to anyone. The FBI, their website got taken down. Whoever out there can be hacked. But if they are and lose data, but they've taken, reasonable steps, that can really, prevent them from being liable.
Okay, great. Thank you, Nate. And does eGestalt indemnify us against legal actions stemming from errors in application or in reports? And is this in writing?
Yeah, so we do not indemnify you, but when your customers log into the tool, there's language in there saying, this is based on our best interpretation of the law. We've worked with a ton of compliance experts in the field, so all the material in the tool itself is really kind of top of the line there. We don't indemnify you, however, your customers do click and have to agree to that legal disclaimer when they log into the tool. So that really is how we address that. And I can actually, if you want to contact me separately, I can send you the actual language that's in the tool when a customer first logs in if you'd like to review it.
Great. Thank you, Nate. And is there a demo product for them to work with, and is training provided?
Yes. So, yeah, feel free to contact me. I can get you set up with the demo account if you'd like. We'll kind of run through, show you the tool. Yeah, and we offer several levels of training. So we've got a ton of material on our partner portal, training videos, those sort of things. We conduct weekly training sessions with our partners. We can do one-on-one training with our partners to kind of teach you the tool. So yeah, we offer a ton of material and options on the training side.
Okay, great. Thank you, Nate. We've recorded this this webinar, and it's going to be up on eGestalt's website at www.egestalt.com probably in a day or so, so feel free to watch it again or forward it to your colleagues or friends. Thanks, Nate, for presenting today, and thank you to the attendees for attending, and I hope everybody has a great day. Thank you. Bye-bye.